Thank you for yielding, Chairman Guthrie, and thank you for holding this important hearing. One of the most consistent issues that I've heard in my district in Pennsylvania is the shortage of physician and healthcare workers and barriers to access to primary care. For this reason, last week I introduced H.R. 2559, the Strengthening Community Care Act, with Chairwoman Stefanik, Representative Blunt Rochester, and Representative Fletcher. And I would further like to thank Representatives Carter, Bilirakis, DeGette, and Spanberger for their support of this measure. This critical piece of legislation would provide for community health centers across the country, including centers in my own district, like Keystone Rural Health Center, Broad Top Area Medical Center, and Hindman Area Health Center, which helps serve the needs of over 250,000 individuals, patients, in Pennsylvania's 13th district. This bill will also reauthorize the National Health Service Corps, which supports more than 20,000 primary care medical, dental, and behavioral health providers through scholarships and loan repayment programs. I, like many on this panel, have heard from communities throughout my district about the need for expanded access to behavioral health care and substance use disorder treatment, and community health centers play an incredibly valuable role in providing mental and behavioral health care to vulnerable populations. Administrator Johnson, what percentage of CHCs provide these specifically behavioral health services in communities today in America?
Yeah, thank you for the question. I think most health centers try to provide some level of mental health services, but it's a significantly smaller percentage. We can get to the particulars on substance use disorder. What we know is that even when they do, they can only meet about a quarter of the demand for mental health services and about 6% of the demand for substance use disorder services.
Thank you. And how important is the stable and sustainable federal funding in the Strengthening Community Care Act to our health centers' ability to continue to provide this access to behavioral health care?
Yeah, thank you. I don't know that I've seen the particulars of the bill. I will say writ large, sustainable, predictable funding makes an incredible difference to retaining the health workforce, to delivering services in the community, to planning for what you can do going forward, to surging to meet critical health needs.
Again, I thank you. How do community health centers typically comply with the requirement to provide emergency services and ensure continuity in primary care services that a patient should receive?
So community health centers are required and closely monitored by us to ensure that they have in place all of either directly or contracted relationships that allow them to comply with all of the Section 330 requirements.
And on an additional matter, we're hearing from community health centers and other providers who rely on 340B that large PBMs are pickpocketing their 340B savings through predatory contracts and without sharing any of the savings with their patients. There's been plenty of talk about the need for more transparency on how 340B is being used. You mentioned earlier in the discussion here today that you collect specific data at HRSA. But on this matter specifically, can you speak to whether HRSA can address these issues through the existing authority, or does it need Congress to intervene?
I believe, Congressman, that we would benefit from your assistance in this regard because we are continually reaching roadblocks when it comes to our authority. So we would benefit from working with you on this topic.
And I agree with you. It is time for Congress to intervene and stop those roadblocks from occurring. Once again, I thank you for being here today. And Mr. Chairman, I yield the remainder of my time.